Welcome back to Psych Waves, where we review emerging and current holistic treatments in psychiatry while learning to better understand the workings of our own minds. I'm your host, Dr. Teresa Anderson, owner and practicing psychiatrist of the Anderson Clinic in Cincinnati, Ohio, where we specialize in treatment resistant depression, anxiety, PTSD, and concussions. So, this May marks having been in practice for 17 years. With PTSD as one of my specialties, I've seen a lot of trauma, both acute and chronic, recent and from childhood, single doses, and repetitive and too many to count. And there's one common thread through all of PTSD patients that I see that comes up over and over and over again. Once the person has moved past the acute phase of the trauma, their body has recovered, but their brains are trying to. The idea of being seen as positively panic inducing, even if it's being seen in a positive way, like a promotion in a job or a recognition for a project well done, or winning an award that requires a speech in front of a group of people, or even being photographed. Why is that? Because of how trauma and stress rewire our brains to link being seen with danger, or in some cases, violence, trouble, or some type of boundary crossing or violation, because at some point that's exactly what being seen meant to them. Let's take, for instance, if you grew up in a household with an alcoholic parent, and because of your hypervigilance based on repeated experiences, aka you were appropriately fearful because you saw it happen enough times, you were able to easily predict whether or not it was going to be a good night just based on how that parent came through the door. If it was going to be a predictably bad night, you would want to avoid drawing attention to yourself. Because if your parent got into a drunken rage, the last thing you'd want to do is make yourself an easy target. And honestly, once that parent was in that type of state, almost anything could tip that rage over the top to lash out in your direction. Sometimes asking a question or getting in the way, as children are prone to doing, not answering quickly enough, or even just being present could elicit a wave of violence or epithets. So then your nervous system learns to associate visibility incorrectly with danger. If you're seen, you could be targeted. If you're seen, you could be objectified. If you're seen, you could be judged. If you're seen, you could be rejected. If you're seen, you could be punished. If you're seen, you could be hurt. And if you hide, you feel like you can maintain some semblance of control and safety. As children, we all want to connect with our parents in a positive way, but that instinct in the contextual environment of a traumatic household can be at war with the need to survive. You're fearful of being vulnerable if you're seen, because if you're seen, then you're likely to get hurt. Fear can actually be helpful in regards to protecting yourself in certain situations. It's smart to not make yourself a target. So what do you do as a child? You shrink out of the way. You don't use your voice as much to draw attention to yourself. You keep your needs to yourself or don't have any needs at all. You become hyper independent and take care of the majority of needs by yourself, even though you don't have the maturity or the skill set to be your own parent. But over time, these protective mechanisms can morph into something far less helpful, like the internal monologue of, don't speak up, just take it, deal with it, it'll be over soon. It's not okay to have needs. That's too much. I'm too much. Don't be too loud. Don't draw attention to yourself. Don't ask for help, or you might get into trouble or be beholden to them for something you're not willing to give. Don't be different, or you will be called out. All of these internal monologues shrink you from a psychic perspective. And to make matters worse, especially if the trauma happened in childhood, where all of us are naturally more self-centered, people take on the responsibility of the not so great parent, as if it is the kid's fault that the parent misbehaved. Or the kid makes assumptions that their parents are not treating them nicely because they are not worthy of being treated well. Even worse, that the kid did something wrong, or they themselves are innately bad people. This feeling is especially damning if you are seen for your true self, which you believe is innately flawed. You're left feeling exposed, vulnerable, and ashamed of the person that you are. If you're seen, then all of your bad parts will be seen too. Even if the attention you're receiving currently is good attention in the present when you're no longer in danger, at least I hope not. but your brain still hasn't accepted the present as being, quote, safe. Repeated interactions with people who have proven themselves to be emotionally safe for you, like friends or partners, can have a calming effect on your nervous system, but it takes a lot of time and repetition to downregulate a wired and tired nervous system that's really adept at staying in fight or flight, but not so used to the whole comfortable rest and digest part. The idea of being seen is typically a lot more triggering than the actuality of being seen for who they truly are as an adult in healthy relationships. And sadly, for a lot of traumatized individuals, they frequently find themselves in relationships that repeat the trauma of their pasts. Not because they want to necessarily, but because it's what their nervous system recognizes as comfortable. But in this case, comfortable does not equate to safe. It just equates to known. There's an old adage, better the devil you know than the devil you don't. I have one to beat it. How about no freaking devils at all? It's good to be able to recognize not wanting to be seen as a trauma response, but exactly what do you do about it? Go to therapy. I know. I'm biased. But for reals, therapy can be a miniature playground for ideas that you've been testing without judgment or harm to yourself in the meantime. It's a playground for what if. Like, what if I'm safe even when I'm seen? Or what if discomfort doesn't have to mean danger? Or what if I say something they don't like? Or are they going to curse and yell and scream at me and throw something at me? Therapy is the best play space for adults to be able to test the waters, in a matter of speaking, and practice what it looks like and feels like to be uncomfortable, yet being safe at the same time. Something else you can do is learn to say no if someone crosses your boundaries, even if it feels uncomfortable, which therapy can also help with this. Not a life coach, by the way, with real world experience, whatever that means, but an actual trained therapist. Medications can also help, if warranted appropriate by a psychiatrist. Another thing that can help is when somebody pays you a compliment, take it, accept it, don't try to deny it, even if it feels scary. Also, honor your hard work to heal and honor your hard work in real life. You deserve to be acknowledged when you've done something well, not to shrink away in the shadows. It's important for you to be able to learn to sit with the discomfort of being seen, especially when it's for a good reason, like an A on a paper or a project well done and turned in on time or early, or you saved money and great for the company, woohoo. Not all attention is bad, but you have to retrain your nervous system to believe it. In the meantime, get your nervous system some rest and play that it so desperately needs. A nervous system stuck in fight or flight is used to survival, but not rest and play. Start taking pictures with your kids. The current time is all we have, and it's never promised for the future, so stop hiding from the camera. And if you're so inclined, read The Body Keeps the Score, which is a great introduction to the idea of trauma and how it can live differently in our bodies apart from our psyches. It's important too to look into either meditation if you have the time, or investing in a vagal nerve stimulator like Pulsetto to calm your nervous system out of fight or flight if you don't have the time. It just takes a few minutes a day. You can be folding laundry, doing other things. And the other important piece of this puzzle too is, what can you stop doing to start feeling better? First of all, stop shrinking to make other people feel comfortable. Stop finding ways to lose your voice, metaphorically speaking. Stop finding ways to be invisible, and stop taking abuse of any variety, mental, physical, emotional, sexual. And if you don't have it, please get the help to support you to be able to do so. And don't drink the Kool-Aid when someone poo-poos you for being too sensitive. If your nervous system recognizes danger, honor that, and don't allow yourself to be gaslit. Stop thinking that you have to do all the things all the time, all by yourself. Asking for help is a sign of strength. It's a bit of a superpower, not a weakness. And remember, discomfort doesn't always equal danger. It just means unknown. Being seen isn't for the faint of heart, but you've already been through the worst of it. This is where life starts getting good again. If you found this information helpful, please like, subscribe, and follow us. Tell your friends. Follow our podcast, Psychwaves, on Apple and Spotify, or on Instagram and TikTok and Facebook at Anderson Clinic Cincy with a Y. If you happen to be in the Cincinnati area and you're looking for assistance with treatment-resistant depression, anxiety, PTSD, or concussions, please give us a call at 513-321-1753 or check us out on the web at www.andersonclinic.net. Start feeling better faster.